my name's Stephen Burke. I'm co-founder and director of United for All Ages, an intergenerational think tank, and we also coordinate the Intergenerational Housing Network. I'm chief executive of two charitable foundations as well, the Hallmark Foundation and the Hemorrhage Goal Foundation. Can I thank you all for joining us this morning? We have a really great lineup of speakers on a wide variety of issues that we're going to be discussing this morning around loneliness, housing, and home share. So why are we here? Let me just quickly set the scene. We have had warnings recently about an epidemic of loneliness in this country and in the USA and elsewhere. And that's not just for older people, but it's an epidemic that is facing young people as well. We all know that there is a housing crisis in terms of access to affordable housing for young people in particular, but actually there are also big issues about the lack of choices for older people in later life in terms of housing. And I'm very pleased that the government has at long last set up its task force on housing for older people. So a chance to try and address that. We also have a crisis in social care. And we're still recovering from the effects of COVID. And the big underlying issue as well in our society is about age segregation and ageism that follows on from that. And we need to tackle that by bringing older and younger people together in different ways. So that all leads us to looking for positive solutions. And I hope that's what we'll try and do with today's webinar, look at positive solutions to all those big issues. And that really is focusing on home share and how home share can address both housing and loneliness, but also some of the other big social issues that we face. I'm afraid to say it's not quite the country's best kept secret, but it is a well kept secret still in terms of home share. A lot of people either not aware of home share or not very aware about how it operates. And I hope that we answer a lot of those questions through today's webinar as well. There is huge potential to solve many of those problems that I mentioned through expanding and scaling up home share in this country. Without any further ado, I'm going to invite the first of our great lineup of speakers, who's Natasha Langleben. Natasha is actually one of the co-founders of Two Generations, and she'll tell us more about their work and how home share operates. Natasha, over to you.
Thanks, Stephen. Morning, everybody, and thanks for joining us today. I'm just going to talk through a few slides just to give a bit of context to who we are and also just the basics of home share, just so we've all got that context as we kind of move along. So, thank you. I was going to say first slide, please. Two Generations is a social enterprise that's been going since 2019. The team consists of myself and Sam Bramman as the two co-founders, and Lisa Goldsabel, who's on the call today, and you'll hear from a bit later, who's our Director of Services. We've got about 16 staff, which is a mixture of both staff and volunteers. It's really important that we are a national service, so we have home shares currently from kind of right up in Scotland through to Bournemouth, right across the whole country. And part of the way that we deliver our home shares is through our Nesta award-winning matching platform. So we've got technology that underpins the work that we do and allows us to work at scale. So if we suddenly get a huge influx and are working with huge numbers of potential householders, we're able to use our technology to match based on a large number of criteria, whether that be the location that people are in, whether that be their lifestyle choices, their diet, the gender they might be looking for in a home share, a huge number of criteria. But what's really important to us is that although we're underpinned by that technology, we're very much about that people, customer focused service. And so Lisa, who heads up our kind of operational team, will talk all about this, and you'll kind of see when she's speaking to our home share later on in this webinar that, you know, it's that opportunity to build up relationships that's so important to us. And our ethos is very much no match is better than a bad match, because it's really important to us that we make matches that last, that are sustainable, and that are going to benefit the people involved. So we work with a whole range of partners. We'll talk about this a bit more later, but in the public sector, the third sector, etc. And a kind of very succinct way of talking about Homeshare in terms of a takeout for everyone here is that it's available and accessible, and that it's very easy to refer someone into our service, and we make sure that's the case. We remove barriers wherever possible, including financial barriers. We really want to make sure that it's beneficial to all parties concerned, and it is successful. And we have huge numbers of testimonials and media stories on our website that can talk to that fact. But importantly, we've got kind of one of our success stories here to talk to you a little bit later. So the challenges that Homeshare is looking to overcome, one, as Stephen referred to, is the loneliness epidemic, and that's loneliness in a wide range of ages. So whether that be older people, but also younger people, there's huge research about, you know, loneliness in younger people as well. And so really, as we said, Homeshare is about meaningful long-term relationships. It's not about a one-off visit. It's like our longest Homeshare to date has gone on for 3 years. We've got lots of Homeshares that have gone on far beyond a year, but also Homeshares where, when they have ended for natural reasons, often those two people in that relationship stay in contact and continue that relationship far beyond the length of the Homeshare. So that's really important in terms of tackling loneliness. We're also all very well aware of funding cuts to health and social care, which has put huge burdens on kind of the professional workforce and means waiting times in hospitals, people not being able to be discharged from hospitals, people not being able to receive the care in the home that they wish and are entitled to. So one of the aims of Homeshare is about keeping householders living independently. So it's about supporting householders at that early stage when they maybe first recognize often that, you know, actually, I'm not sure I like living alone, or I might have had a fall and I think, you know, if I was to fall again, then I might not be able to live independently. Often we get people at that much earlier stage thinking a home sharer will allow me to remain in my home, which is the choice that I want to make. We similarly can work right along that spectrum and complement people who are further down that line or who already have carers involved. But it is really important that if householders' choice is to live independently, we're here to try and support that choice. Another challenge, which goes without saying, is the unaffordable rent prices at the moment, even more so during this kind of cost of living crisis. So Homeshare allows the sharer to live in a more affordable way in combination to giving back and supporting their householder. And often that means they might be able to live in a location that they might not otherwise have been able to afford. And finally, the care system is under pressure. We know there's lots of informal carers, family members, neighbours who are supporting people with their own challenges who don't get any respite. And actually knowing that somebody else is living with this householder relieves them to know, actually, there's someone there overnight. I can be a little bit more relaxed in knowing that that support is in place. So those are some of the aims. I think it's just worth saying as well that although we typically talk of householders as being older people and sharers as being younger people, that's on a very wide spectrum. So our youngest householder at the moment is in their 30s and is someone living with a brain injury. And we have sharers who are in their 60s and 70s. So there is, although we talk about older and younger, which is the traditional model, there are lots of reasons why someone might want to be a householder, which could include a physical or a mental kind of disability. So it's worth understanding the wide spectrum that Homeshare can support. Fine. Okay, so the next part is really the nuts and bolts. It's the basics. What is a home share? So essentially involves two people, a householder and a home sharer. The householder is, as I said, typically an older person, but may well not be, with a spare room. They do not have to own their home. They can be renting their home, and won't go into all the details there. But again, you know, it's not specifics. So own, rent, etc. They may feel lonely or isolated. They might be looking for companionship or benefit from some practical support in order to remain in their home. And there's a kind of wheel on the right of some of the areas of practical support they might require. It's very bespoke to each party, but it could include support with cooking, household chores, gardening, etc. The sharer, typically a younger person, will live with that householder, providing the companionship, and that's the vital part, and then also the help around the house and offering that peace of mind and reassurance that someone's there overnight. Every match is bespoke, so some people may require more or less support around the house, or would like people to be in the home more or out the home more, etc. And that's, you know, that's really important, that the match is bespoke, but that's the basic kind of nuts and bolts of a home share. So what I'm going to talk to you, I know the infographic is going to come up, is the process that we go through when someone is first referred to us. So it's quite an important process. The first thing is that you contact us, and that might be an individual contacting us or a partner organisation, a referral partner. We then find out all about that householder. We meet with them, typically over Zoom, and find out lots about them, their reason for wanting to home share, all the kind of things that they might be looking for in a sharer. We'll then look at our application forms. We have a huge database of sharers looking for a wide range of locations, etc. So we'll review our forms and we will start interviewing the best matches. And we really make sure at this point that we don't pass someone on to you as a possibility unless we've had really good conversations with them and feel that they're a great fit. At that point, we'll send you an example and say, you know, are you interested in this person? Does this sound like someone who might be a good fit for you? And you'll then have typically an online matching meeting, which is facilitated by the Two Generations team and allows you to go through and understand more about this person, everything about them as a person and personality, but also about how you may go about living together and what kind of expectations there might be. If you think, yes, that still sounds of interest, they will come and visit you, and you know, you'll have a tea or coffee together and just see how you get on face to face, you know, for a few hours, one afternoon, etc., just to make sure actually, yeah, this person seems like someone I could really live with. At that point, we'll carry out all our checks, and I'll go into that in a bit more detail shortly. If you continue to want to progress, the home sharer will then move in for a trial period. And assuming that trial is a success, the really important thing is we offer continuous support. So what we're not doing is saying, great, that worked, goodbye. We are there the whole way through. We'll have a relationship with both parties because of this extensive kind of period. And we will be at the very minimum checking in monthly just to make sure everything's going okay. But if there's some niggles at the beginning, as there are sometimes just by virtue of bringing two people together, we're there to support with that, to help mediate conversations and just make sure that everyone's able to speak openly and kind of move forward in a positive way. And at any point throughout this journey, a householder can say, this isn't the right person for me. So it's, you know, it's a really important journey we go on to make sure that it's a long-lasting and sustainable match. So next slide is about safeguarding. We know that safeguarding is absolutely at the heart of everything we do and is a priority for everybody who approaches us. We think it's really important that although home share as a concept, as Stephen alluded to, is still not that well known in the UK, the concept of bringing someone into your home is quite widely known in lots of other settings, whether that be bringing a nanny or an au pair into your home for childcare, or whether that might be bringing a carer into your home. There's often lots of reasons that people are bringing in a carefully vetted individual, and we follow just the same safeguarding as you would expect from all of those kind of agencies. So as we said, the sharers complete a very thorough application form. We don't want people who are just thinking, I want cheap rent. You know, this is not the opportunity for those people. So they complete a really thorough application form about why this is something they want to get involved with. They're involved in phone interviews, video interviews, lots of different steps. We do enhanced DBSs, which is the police checks. We obtain 2 references. We also make sure you as a householder and your family, which can include professionals and advocates, have lots of opportunities to meet that sharer before the home share begins, both online and in person. And as we said, there's often a trial period, which could include a trial weekend if that's felt necessary. And we remain that constant point of contact and support. So finally from me, it's just really important for everybody here that they're aware of our partnership programme. So our partnership programme allows other organisations, whether they're from the public sector, the health sector, the third sector, to refer individuals into us. And we've got partners kind of here on the call. You're going to hear later from Julian, who's the chief exec of Age UK in Harrow, Hillingdon, and Brent, who are one of our really important referral partners. And whether, as we said, whether you're a charity, a private provider, etc., there's a really easy way to partner with us. And essentially, we make it as easy as possible. We remove the barriers. You make a referral and we handle everything from there. So we've got what we call our playbook, which essentially means we've done this before. So we know how to provide you the advice and information, all the agreement templates, the training and support for your staff. We can support with events and promotion of Homeshare, all the reporting in terms of making sure that you're aware how many referrals have come in, how long have those referrals lasted, how many are we matching, etc., and support you in national and local events. So if you look on the right hand side, it's just a few examples of some of the material that we have. The bottom right is us on the Age UK website and that kind of co-branded 2Gen and Age UK visual, and also to the right where you can see the kind of multicolored brochure. That is a piece of literature that we've produced with Age UK that is now being used at all their events and for all their partnerships, which includes testimonials from our existing home shares, etc. So it's really an important takeout for us, for anybody here on the call, that if as a result of this webinar you think I'd like to find out a bit more and I might be interested in being a referral partner, please do get in touch via the email contact@twogenerations.co.uk or message myself, Lisa, Justin, any of the people on this call. We'd be really happy to talk to you further. Yeah, and obviously I'll be around for the Q&A, but thank you very much.
Brilliant. Thank you very much, Natasha. That was very, very clear. I'm now pleased to introduce our next speaker, who's Andrew Laird. Andrew is MD and co-founder, or CEO and co-founder at Mutual Ventures, and he's going to address some of the big issues and implications that we've already touched. Andrew.
Thank you very much, Stephen. So I'm not using any slides, so I'm just going to rattle through a few things here. So there's just 4 broad things that I want to say quite quickly as to why I think this is a really good idea. And I'm not sure exactly where all of the participants are from, but if some of you are from councils or from the NHS and are thinking about this, then I think that there, from my perspective, are at least 4 really good reasons why you should be looking at this and encouraging it. The first one is about the general trend that we're trying to move, how the public sector and how health and care moves away from crisis, responding to crisis all the time, towards prevention and towards trying to keep people healthier and at home longer. The second is the whole agenda now around building really great places and really great communities where people want to live. I think this contributes really strongly to that. The third is the cost of living crisis, and how this is something which can really help people with that. And then the last one is the fact that councils, by and large, do not have huge amounts of funding to put into services. So actually, when I look at this, I start to see something which is very community driven and isn't asking councils to write out a huge check. So if we take the first bit there, which is moving from crisis to prevention. So there's a huge amount of interest across the system about trying to reduce demand on hospital services and reduce demand on formal adult social care as well. There's the whole, I'm sure you all know about the whole new integrated care systems, integrated care boards. Within that, there are also places which have been identified, and those place leads tend to be the chief executives of councils, and their job is to try and make the best use of the assets which communities have. Now, the people within communities are their best assets, and I think what this program does is really make use of that. It looks to try and find the best instincts and within people and make use of it in a mutually beneficial way. And sometimes the public sector tends to reach for very formal interventions for things, and things that have to cost money. But for me, this Homeshare idea, it's all about reaching and trying to make use of the really kind, caring instincts that people have. And I think that this is a perfect idea which NHS place leads and council leads should be really looking at and trying to encourage and engaging with people like Natasha and the team. The second reason I think this is a great idea is that idea of community building and place building. So when councils are thinking about creating a great place to live, it's not just about the physical assets, but it's about behaviours and culture as well. And if this can be encouraged, I think we're starting to lose a little bit of that intergenerational support and respect that is so important for a community to thrive and for a place to be a really great place to live. There has to be that respect. And I think this is a programme really increases that. And it also increases levels of community engagement. So the people who are being supported in their own home through this scheme, they're more likely, they're more likely to get out there and be more engaged in community, even participate in the local economy as well. So this is a good, virtuous thing. The third point is around the cost of living crisis, and we are up to our neck in this. And anything which can create a more affordable living place for a person, and they have to give something to get something. I think that's really important. And this, somebody mentioned London, particularly in London, that is really important. And I don't think enough people know about this, and I don't think councils and the formal public sector are doing enough to raise awareness of this, because it is not something that has to cost the public sector a lot of money. It's about people in a community giving something and receiving something in return. And we tend to lose quite a lot of that, as people expect the public sector often to kind of take care of everything. But this is a wonderful scheme which is drawing on the kind of human caring nature and human kindness to solve what is a really big problem. And I know that from people like Julian later, we'll hear about the problems of loneliness and how that drives ill health and long-lasting conditions. And then the final point really is just around the fact that for councils, they really don't have a lot of funding, and there's a lot of pressure on the funding that they do have to spend that in different ways with a lot of statutory responsibilities. I think councils could gain a lot, and the NHS working with councils could ease a lot of pressure on the formal NHS by encouraging the uptake of this type of scheme, which uses, like I said earlier, those community assets, which by and large include the kind of good nature of people and that caring nature of people. And we're not doing that enough. And I just am extremely excited by this scheme, and I'm really pleased that this webinar is happening, and I'm delighted to have had the opportunity to contribute to it.
Brilliant. Thanks a lot, Andrew. Very passionate exposition of why this is a no-brainer for councils and for integrated care boards and others. I also think you gave us some quite good lines there, which will help promote Homeshare as well. I like the kind of the giving and receiving something line. Right, so we've already trailed it, but I'm really pleased that we have all the way from Bournemouth, I think. We have Sheila and Dela. Sheila's the householder, Dela is the sharer. They're going to be in conversation with Lisa Goldsobel, who is the Director of Services with Two Generations. And perhaps, Lisa, you could also touch on some of the questions that have already been flagged up in relation to safeguarding and charges and stuff like that as well. Over to you.
Thank you very much. Well, I'm happy to address some of those questions afterwards, but I just want to dive straight into it, following off the back of that really positive, exciting vibe from Andrew. And as we all know, the whole point of Homeshare is about people. It's about the individuals. It's about how it affects them and their day-to-day life. So we thought it was crucial as part of this webinar to actually have an example of a fantastic Homeshare that we have. So I'd like to welcome Sheila and Dela. We first met Sheila actually in April 2021. It was that long ago, Sheila. And we were in a fortunate position of actually being able to provide her with several home sharers. And her current one, Dela, they've been together now since the 18th of February, nearly 5 months. They are fantastic supporters and advocates of Homeshare. They've actually helped us and spoken with the Department of Health and Social Care to help them further understand the Homeshare model. And they're due to feature in Prima magazine and Saga magazine as well. So we can all keep a lookout for them. So if I can invite you, I don't know if you guys are on mute at the moment.
No.
Great. Okay. So lovely to see you both. How are you guys today? You okay?
Fine.
Yes,
Very well.
good.
Very well,
All
thank
right.
you.
So, Sheila, can I ask you just to share with everybody what first led you to look for a home share way back when you contacted us?
On the 16th of February 2021, my husband died. And I don't know why. I just hate it when it goes dark. It's just strange. I just hate it. I missed him so much. And I just wanted nice company, someone to talk to and someone to live with when it got dark, more or less. It's very stupid, but I'm not scared of anybody moving in, but as soon as it turns, not moving in, getting into the house, because I've got security, but as soon as it turns dark, I absolutely hate it. I don't know why. Yeah. Also, I needed help because, and it's still now the same thing, I need a shoulder operation. I've got to have a replacement shoulder. And I've got Dela who cooks for me. And not only does she cook for me, she makes wonderful food. It is delicious, honestly. And I can do my lunch, like I can put a piece of bread in a toaster or something. But if I pick something up, my arm, it doesn't go any further than here, sort of thing. It's really, really difficult. And it's lovely having Dela because we joke with each other, don't we? We wind each other up all the time, and we just laugh.
So we talked together in the early days then about those key requirements you had. So it was that overnight presence and that reassurance of someone being there, and that sort of practical help of someone helping you to physically lift the saucepan so you could cook, and just having that bit of practical help around the house.
Yeah.
And so, Dela, what was it that made you look to Homeshare as an option?
I moved from London to the wonderful south to Bournemouth for a job role. So my background is in health and social care, working with adults with complex needs, learning disabilities and autism. And I was working for a wonderful charity. I had a very poor experience with COVID and I picked myself up from London. I wanted a fresh start. So the fresh start was here in the south. And when that job came to an end, I chose to use my 24 or 5 years of experience to set up my own care service here in the south. And as embarrassed as I was at the time, Lisa, I remember picking up the phone when I found the advert and saying to you, I'm actually lonely myself, and the home shares that I was looking at just didn't tick the box for me. And I've always been in health and social care as a carer, frontline worker, manager, operations manager, you name it. It's something that comes really naturally to me. And when I saw the advert, it made sense. And the one thing that I was really nervous about saying is I'm lonely. And I remember saying it to you and how comfortable you made me feel. And I suppose Sheila's personality, when we spoke on the phone and when we met, it was written for me. Well, everything happens for a reason. Otherwise, I would have been heading back to concrete London and probably miserable in all the traffic and the pollution.
I remember us talking and me saying exactly that many sharers do say the same to us, that they are lonely too, and companionship is a really important part for them as well. So how, you can already see already, and we just wanted to be able to demonstrate what a lovely relationship you guys have got, but how would you summarize in terms of the benefits of Homeshare? How has it really helped you? What are those key areas? So I know for Sheila, it's that reassurance of overnight, having some delicious food. What else would you say are the benefits of Homeshare for you both?
Companionship is the most important of all of it. Can you say?
Absolutely.
And okay, having food, right? Well, everybody eats food, so it's just that we trust each other. And not only that, if she's away at the weekend, say, she actually contacts me to see how I am. She sends me a text and asks me, and that I think is lovely. And when she's on her way back, she also sends me a text, even to say, I won't be home till so-and-so, but it's good that I know, you know what I mean?
Because we've always said Homeshare is about creating those genuine relationships. It's not, we don't find lodgers, we find companions. Can you tell everyone a little bit more about the process that you experienced with Two Generations, and sort of at first getting in contact with us, the matching process? How did you find that? If I start with Dela, how did you find the overall process of it?
It's very similar to, so in my line of work, when we would be matching live-in staff or staff to support somebody in their own home or in the community, the process is very similar to what I'm used to. I think for me, it was just how much detail Lisa went into the advert, and even speaking to you, how well you knew Sheila. It was just a real personalised touch. Speaking to Sheila on Zoom with her family, that was set up really quickly. We were able to ask all the questions that we had on our mind. And then the meet, I suppose, meeting you and meeting the cats. The cats were a very important part of the interview process.
They're not here.
They're not here today.
The cats usually appear on our Zoom meetings, don't they?
Muffin.
They did come and sit on my lap during the interview when I came to meet Sheila, and you showed me around the house.
Yes. The garden and the garden.
The garden and the house. I met your family on that day. And I suppose the other thing was being able to move quick, things that I'm quite familiar with, Lisa. You still talk me through the stages of the DBS check and the references. It was really smooth and easy, things that I was familiar with. Sheila, anything for you in terms of giving you reassurance?
My family gave me reassurance. We invite, wherever I'm invited, we invite Dela as well. It was my son's 50th birthday on the 10th of June, and we were invited to the party, and Dela was invited, and we had a lovely time, because my family accept Dela as part of the family.
And Sheila, do you feel supported throughout the process of Homeshare? The fact that we've obviously had this contact, that as a householder, we don't just put people together and leave them to it. We make sure that people feel supported throughout the process.
Well, I have written something that I wonder, I did send it to you some time ago. And it is, yes, because I was writing a thank you.
You were.
Thank you, Lisa, from Two Generations, for giving me peace of mind by introducing me to my new companion, who is so kind. There is such an age difference, but it does not matter. We're always able to laugh and chatter. So if you're looking for some company and are home alone, just contact Two Generations. Pick up the phone.
Thank you. So, well, Sheila, that was seamless, because I was literally going to say, what would you say to someone who was considering Homeshare? And I think you've summarised that beautifully. So thank you guys so much for your time and just for being fantastic ambassadors of Homeshare and helping to spread the word. I really, really appreciate it.
No, thank you, because you're always keeping in touch with us, and it's lovely.
Pleasure.
Brilliant.
Thank you,
That's
Lisa.
a great two-way endorsement, and thank you both to Sheila and to Dela for sharing that with us and for being so honest. And thank you, Lisa, for facilitating the conversation. I'm pleased to introduce Julian Lloyd, Chief Executive of Age UK, Hillingdon, Harrow and Brent. Julian.
My name is Julian Lloyd. I'm Chief Executive of Age UK, Hillingdon, Harrow and Brent. Age UK is a federated charity, so there's Age UK, a national charity, and then there are around 120 local Age UKs, which are independent charities but affiliated to that national charity. So we are one of those. We operate across Hillingdon, Harrow and Brent, which are 3 boroughs in West London. So unlike Sheila and Dela, we're still stuck in the concrete jungle, but sort of on the periphery. So we have some of the Brent, which is more of an inner borough, Harrow and Hillingdon, more outer boroughs. But I was going to sort of talk really a little bit about why we feel that Homeshare is a really good option for us, and why we've embraced this partnership. And for us, it really, I think one of the key areas that we see amongst older people across our part of London is isolation and loneliness. That's a sort of one of the sort of fundamental challenges, and one that's been exacerbated really over the last few years, particularly through COVID. And we see Homeshare really as very much part of that portfolio of services that we can provide and offer to older people. And for a significant number of people, Homeshare is a really good option, a really viable option. And we've heard from Sheila and Dela talking about their experience, and we've got some really good case studies and examples of people within our area as well, where Homeshare has been really, really successful. I think what we see is, often as Sheila talked about, some of those early trepidation that people may be a little bit wary about Homeshare or have a lot of questions about it. And as a local charity working in partnership with 2 generations, we can help to explain some of that and help people to overcome some of those hesitations perhaps, and engage at least with the concept of Homeshare as something that might be helpful to them. So we see that as really, really key. And for us, there's a really strong alignment in terms of what Homeshare can provide to older people and what we're trying to achieve as a local charity wanting to support older people. So it provides companionship. It provides support at home, very much, it might be, as Dela said, helping with cooking. It might be rescuing somebody from spiders, whatever it is. But that sort of support at home is a really, really key factor. But also having somebody at home, having a companion at home, can help that individual to regain that confidence again. So there's a potential there through that companionship, perhaps to help somebody to re-engage with local community activities, to help to get to GP appointments, to help to monitor some of those low-level risks as well, and to prevent something escalating into a crisis point, because somebody's there on a day-to-day basis and can sort of pick up something at a really early stage. So we see Homeshare as that absolutely a fantastic service, has huge potential. As Andrew said, it's something that we would really promote very much with statutory commissioners who are sort of looking at costs and spiraling costs of health and social care and impact to the system around what is almost the cost of older people, and something like this, which comes at no cost, can really help to massively improve quality of life, but really sort of support all providers within the system as well.
Thank you, Julian. Very clear about why Homeshare is needed more than ever. We're now going to hear from our final speaker, who's Jason Brandon. Jason has a national role as mental health social work lead at the Department of Health and Social Care. Good morning, Jason.
So I've only got 3 slides, just to reassure you all. And I'm not going to talk in finest detail about all the words on the different slides, but this first one is really spanning across the different priorities of the Chief Social Worker's Office, which sits in the Department of Health and Social Care and hosted within the Adult Social Care Group. And from a social work perspective, I'm looking at this in terms of thinking about why Homeshare is particularly interesting and where it sits in terms of the professional interests of social work in terms of its relationship with policy and practice of the day. And the first thing that really strikes me on the top of the list there is that actually social work now, which is described and governed by the Care and Support Guidance within the Care Act, is very much built on relationship practice and very much built on strength-based approaches with people. Social workers are trained and governed to be able to support people to identify need and meet service with meet that need with respective services, but in a way in which is personalized. We hear about personalization, we've heard about it over the last 2 decades or so, and it very much chimes with the social care value base about ensuring that the person is at the center of determining how their care and support is provided. So it's co-produced. So actually thinking about Homeshare and thinking about the opportunities and the way in which the process has been described this morning and articulated by Natasha, Lisa, Dela, and Sheila, actually the experience is very much in tune with that set of values where you're listening to how somebody conducts their preferences, what's going on for them. It was lovely to hear the way in which Sheila was really candid about actually her experience of living on her own, and frankly, she was quite capable of managing her life on a day-to-day basis, but she's afraid of the dark. And in the same way, we were hearing from Dina about, you know, the issues around loneliness, etc. All very much chiming into how social workers should be engaging with people who are referred through into services and understanding what their needs look like. And I'm gonna just reach down across the piece and some of these things that we've already touched on. We know that the social care sector is under a huge amount of pressure from a workforce perspective, the number of vacancies, etc., across the market, where different strategies are reaching to international recruitment for different solutions and different remedies to different types of accommodation and service offers, etc. This Homeshare offer is really innovative. It provides a really bespoke way to be able to support somebody in their own homes with the care and support to offer that reciprocity. And also it's focused on being able to be inclusive in an era where we know that actually we're as a result of the pandemic, etc., minority groups really struggle to get and reach the services that meet their needs effectively. Homeshare, I think, also sits really neatly and squarely with a very busy policy reform agenda at the moment. Building the right support, people at the heart of care are all about making sure that we've got sufficient types of options in a personalised way that support people with accommodation needs. So I'm not going to repeat what we've said already, but certainly there is a resonance with innovation, with technologically enabled care tech, and looking at the abilities that we've got on digital platforms to be able to connect people across the piece. And it was said, and as Julian was saying earlier, also thinking about integrated care systems at place, thinking about actually how we're supporting our communities to grow. So from a professional social work perspective, Homeshare ticks lots of these boxes in terms of thinking about how social workers should be approaching their relationships with people who are referred in to for assessment around care and support. If we can go to the next slide, mental health and loneliness. As the mental health social work lead, this is as important as it's ever been. the policy position on loneliness sits within Department of Culture, Media and Sport, but I know is shared with 21 other departments. And there's an enormous amount of work which colleagues on the call, attending and on the panel will be familiar with. But from a mental health perspective, and I'm sure the slides will be shared, but you'll be able to see, and I've cut and pasted the links in there, to some of the work and some of the studies that have been focused on mental health and loneliness. We've already talked about it, but just to give some headlines, when we talk about loneliness in any event, at the same time, we're talking about isolation. And there is a really clear researched evidence-based correlation between isolation and poor mental health, anxiety, depression across the whole of the life scale. If we become lonely, the likelihood is that we'll become more isolated. If we're more isolated, then we're going to become more lonely. It's a cyclical phenomenon. And compounding that, and as was described earlier by Dina, that there is a stigma associated with loneliness, and objectively it's described and perceived as people feeling weak, unreliable, attention seeking. And certainly others may a bit as it says on there, that others might see people as sad, needy or desperate. It's a really unpleasant phenomena, but thankfully it's something that we're waking up to in terms of being able to have some focused policy support. I would urge you to have a look at those links. There's some really, really strong information and support information. And I know that local systems are tapped into loneliness hubs, etc., that are really making progress in local communities, and again has been alluded to in terms of really building up local culture. So my last slide, if we can go to that one, is really kind of drilling down why social workers should be thinking about innovations like Homeshare, much of which will be familiar to colleagues, but really to endorse that from the chief social worker's perspective. And lastly, I just think it's a real boon to kind of independent living and ensuring that people are able to feel safe. And I really pick up on what Sheila was saying and Dina was saying earlier, and that really resonated with me, that the key things that actually we haven't really tangibly kind of spelled out in terms of this is that there's a trust, there's a companionship, and I also wrote down that peace of mind. I think from a social work perspective, that absolutely chimes with social work values, etc. And I'm really, really pleased to be able to endorse that and happily take away a huge amount of knowledge that I didn't know before I joined the webinar this morning. So thank you very much again for inviting me, and I'm happy to take any questions or contribute to a discussion.
Thank you very much, Jason. And thanks for your endorsement and bringing together quite a few of the threads of today's webinar as well in your presentation. So thanks very much for that.
Thank you.
Okay, so there's a lot for us all to do to take this out and to maximise the potential of Homeshare across the whole of the UK. But I'm sure we've got people here who can help make that happen. Can I thank everyone today who has joined us? Thank you for all our attendees. Thank you to all of our speakers who've been very, very clear and forthright. There are 3 questions which are quite specific to you, Natasha. So I think I'm just going to deal with them now. 2 are from Chris Frederick, who asks whether the matching platform that you have is unique to only 2 generations. He also asks how long is the trial period? And then Jocelyn asks about how do you enable older people who don't have access to online digital platforms to partake? You're on mute.
I just realised that. Apologies. We had to have one of those. First question in regard to the matching platform, yes. As far as we're aware, that other Homeshare providers tend to be working more manually and also tend to be local. There's lots of local providers. We're a national provider. So it's one of the reasons that it allows us to kind of work right across the country, because we have that matching technology that's won awards, as we said, by Nesta. So that was the first question. The second one was, remind me.
It's about how long is the trial period?
The trial period is typically a month. As we said, it can be bespoke. So if someone wants a trial weekend first before moving in, there are other ways, and we do really work to bespoke arrangements, but typically that's a month. And the third question about people who don't have digital technology. So there's a number of ways around this. Sometimes people have other advocates for them that can support. So we've had people like befrienders, neighbours, social workers, wide range of other people who are able to come in, who might be able to, through their phone, set up a kind of FaceTime call, a Zoom call to support them with that. If there's absolutely nobody in their network and no way of them getting online to have some of these conversations, then we can work face to face. So, you know, it's not impossible for us to go and meet someone face to face. It's just that it typically works better if that initial part of the process is done online. And we've worked with a wide range of people connected to that householder to make that happen on many occasions.
Right. You've also got a question from Nathan Winch, who's from the GLA. I think his question, are you operational in London, has already been answered. Yes.
Very much so, yes.
Yeah, and Nathan, perhaps you can share details of your London event today through the chat. But Nathan does ask a much bigger question, really, about does Homeshare have any clients who have dementia?
Yes, a huge majority is the kind of short answer to that. Of our current Homeshares, a huge majority have dementia. And again, as I've said about kind of bespoke, we have to look at each individual and whether Homeshare is the right opportunity for them. For some people it won't be, and we're really upfront about that, but it can really support a lot of people with dementia, particularly at that slightly more early onset, mild to moderate dementia, we would say. If we think there's going to be safeguarding risks and actually this person needs much more support than we're able to offer through somebody who is not a carer, we would always address that. But we can talk about that in more detail, Nathan, if you'd like to, separately. But we have a lot of experience. We've recently had our staff go on dementia training, and yes, we're very well equipped to work with people with dementia.
Okay, I think you've already addressed the issues around safeguarding, but perhaps we can come back to that later. Do you operate in Wales? Does Two Generations operate in Wales?
We do, yes.
Okay, that's good. And can you just explain a bit more about how the charges for householders and house sharers and the cost issues for referrers?
Yes, so in terms of the costs, I won't go into every number now because we can send that through, but essentially because the numbers change slightly depending on how much support someone needs, but we have a fee for the householder and a fee for the home sharer who pay us on a monthly basis. We have a bursary in place for the householders, so if they really can't afford the fee, which is typically kind of £99 to £150 a month, then we would know that, you can discuss with that the use of the bursary. But we make sure that when compared to, for instance, the cost of bringing any other form of care into the home, we are an incredibly affordable option. For the sharer, the cost is always incredibly competitive in comparison to where they might be paying rent for another property. So typically it could be £300-400 a month. Again, it depends how much support they're giving, what location they're in, but those are the kinds of costs attached to it. For referrers, there are no costs. So we're very much wanting to make kind of these embedded referral pathways to make sure that referrals can come in on a regular basis and there's no cost attached to that.
Great. Thank you very much, Natasha, for rattling through lots of questions very quickly. We'll may come back to safeguarding in the general questions after all the speakers. Nathan has already put in the chat information about the London event, so do have a look at that in the chat section. Can I just ask Sheila and Dela? I mean, there were a number of big issues raised, obviously around loneliness and so on that we touched on earlier, but also the issues that you both face in terms of affordability. So for Sheila, being able to share some of the costs of your home, and obviously Dela being able to access affordable housing. Can you just say a bit more about that? How has it helped you on the affordability front with the cost of living crisis?
I think for me personally, I'm trying to set up a care service from scratch. That's really was my focus before I found my accommodation here with Sheila, and it's really helped me in terms of the geographical location as well, sitting right in the heart of my contacts are across Portsmouth, Bournemouth, Poole, and Dorset. So geographically it's been brilliant, and financially absolutely, because I'm able to invest my time and then also invest financially into the service that I'm really passionate about, and I'm really keen to be provider here in the south. And I think the other thing that it's the quality of life of where I am and the things that I'm able to do that's really helped me turn my life around. And I said it earlier, you know, not going back to the concrete jungle and the polluted area of London is fantastic. So
I come from London, honestly. I do, yes, but left it quite a long time ago. What was about 6 years ago, I think it was. Yeah, left it.
Yeah.
And came here. Well, we had the house here quite a long time, and financially, I can cope financially. I mean, let's say, for instance, I had to have a carer in the house. You know, one that had, you know, that's come to the hospital. They give you a carer. It's £1,000 a week. Do you know that? It's £1,000. So. No, thank you. No.
Okay, no, that's again very honest. The final question: people have raised questions in the Q&A about safeguarding, but clearly, I mean, from what you already said, you both feel very confident and reassured about all the processes involved.
Absolutely. I mean, Lisa kept for the first month. We had regular contact with Lisa. She was on the other end of the phone, sending us messages, calling.
Yes.
So that was really supportive. If I was always made to feel, if there's a question, pick up the phone and ask, and reassured by Lisa, as well as having Sheila and her family being very supportive.
Yes. And do you remember before you came, I got your profile and I could read your profile and I thought,
oh yes, yeah.
I wonder if she's telling the truth. I wonder if this is really, you know, this happened sort of. And you were telling the truth. So.
Well, the one thing I didn't put on my profile is I'm scared of spiders. So I'm very grateful to have a companion who will say, come on, darling, to the spider and pick it up and find it at home away from me.
Because she screams. She says, there's a spider here, Sheila. And I go and I rescue it. I don't think it's fair to kill spiders. I really don't.
You say
that's a very good marketing line then, no spiders here. So. Great. Thank you both very much for your contributions this morning, and thanks again to Lisa. And Julian, can I just ask you, I mean, obviously you have a partnership with Two Generations in Hillingdon, Harrow and Brent. What about other local age UKs? What are they up to?
So we're very much sort of promoting it. I mean, I think this is an early partnership for us, but we think it's one that's really exciting and has huge potential. So we're working with the local age UKs, promoting it as well, and we're hoping that it's something that other age UK partners will embrace and take on as a partnership as well. So we're very much sort of flying the flag in West London and encouraging other age UK partners to look at engaging with Homeshare as well. We think it's really, you know, a really key, really important scheme.
Okay, and then Lucy Cubitt is obviously keen to investigate Homeshare as an option for their residents, but she says, can you just clarify, as a partner, do you promote the service with Two Generations delivering, or do you do any of the active delivery?
So the great thing that around the partnership that we have with Two Generations is we were able to work that through together in terms of what we provide and what they provide. So with our partnership, we do provide some local services. We can help with introductions. We can provide some of those sort of wraparound services. We can help people with benefits checks and help people to engage with local services as well. So we take quite a proactive approach in terms of how our partnership works, but Two Generations offer that sort of flexibility. So I think if other age UKs or indeed other partners are considering this, you can take a more active or more passive role depending on, I think, the nature of your charity and what you offer at a local level.
Brilliant. Thank you very much, Julian.